A heart rate more than 100 is a risk. If you go to take a life insurance policy and if your heart rate is more than 100, they will levy you extra premium. If you do low intensity workout, you do 1 hour of activity for all 7 days. If you do moderate to severe intensity workout, then 1 hour 5 days a week or 45 minutes 6 days a week.
Okay.
But you need to give 1 day rest to your body. I would say that symptoms like unusual gas and unusual acidity are never to be ignored.
Okay.
My 99% of the heart attacks come as unusual gas and unusual acidity. Nobody comes as a heart attack, nobody comes as a chest pain. Walnut and almond are probably very good for heart, and pistachio and cashews are not so good for heart. Don't rely too much on your smartwatch. It does not tell us anything about prevention of heart attack.
Your heart. It works around the clock, no breaks, no days off. But have you ever wondered what it takes to keep it that way? I'm Jagu, and in this episode of the Good Doctors Podcast, we're digging into the engine room of your body, your heart, and what it takes to keep it strong, steady, and beating for years to come. And we're not just scratching the surface. Today, we're joined by Dr. Chetan Shah, interventional cardiologist who's seen it all, from routine procedures to the most complex life-saving interventions, from cutting-edge treatments to the questions you should be asking your doctor but probably aren't. Dr. Shah is here to help us break it all down. So, if your heart's been trying to tell you something, now's the time to listen. Let's get into it. Dr. Chetan, thank you so much for taking out the time joining us on the Good Doctors Podcast. We're really looking forward to your input.
Thank you.
So let me get to the basics first. This is just so that we have a basis for understanding what we're talking about, then we're going to get into details. For something as simple as heart attacks and cardiac arrests, as lay people, we use it interchangeably. But there is a difference, and I think it's important to understand that difference because it's critical in the first 2 minutes of an emergency, isn't it?
Absolutely. These are two different things. Heart attack means there is a blockade in our coronary arteries and there is a decreased blood supply to that part of the heart. Cardiac arrest means there is absolutely stoppage of the heart because of some electrical activity like ventricular fibrillation or asystole. So that is basically an electrical activity. So what are the symptoms of heart attack? You have chest pain, you are short of breath. What happens in cardiac arrest? Cardiac arrest, you are absolutely unconscious.
Okay.
Pulseless, BP less. So what we need to do, what is the treatment for heart attack? So treatment for heart attack is giving like sublingual nitroglycerin and a dispirin and then rush patient to the hospital.
This is the immediate
treatment
get your
for
hands on a
heart attack.
dispirin. Yeah. Okay.
And what is the treatment for cardiac arrest? So cardiac arrest, we need something known as cardiopulmonary resuscitation.
Okay.
So as a lay person, we can give thumb on the heart, we can do cardiac massage and straight away ask for help. Get in an ambulance, get in an help and transfer the patient to the hospital.
So that's what you call CPR.
That is CPR.
Okay.
So CPR, so the most important thing in CPR is to press over the sternum, not over the left side of the heart. Because
the dead
heart is
center.
mostly in the center.
Okay.
So that is very important.
Okay.
And now, what are the survival chances? So heart attack, survival chances are more than 60%.
Okay.
What are the survival chances in cardiac arrest? If the patient gets a prompt treatment, the chances are about 5 to 10%.
That's it.
That's it.
With prompt treatment, 5 to 10%.
Absolutely.
But this is because the heart has stopped.
Absolutely.
Essentially,
so heart has stopped and heart will need defibrillation.
Okay.
So we have run a campaign at several places in Mumbai, at public places, at our Gymkhana, at Jolly Gymkhana and in Otters Club, Bandra. We have put defibrillator machines, which are known as AED.
So what are those? What do they do?
So defibrillator machines give a shock
Okay.
to the heart. And those electrical fibrillations, electrical activity are being converted to normal sinus rhythm. So if a patient gets those defibrillation treatment immediately, then that will be a very dramatic treatment to the cardiac arrest.
So we have the defibrillators at assorted venues and the hospital has taken the trouble to go and keep them there. But I'm assuming somebody there is also trained to execute.
Absolutely. So there is a CPR team at different places. So if they are called, they will come immediately.
Okay.
But what we have done is we have run a campaign to teach the gym trainers, to teach some normal individuals how a CPR being done. So at our Jolly Gymkhana, we have taught our trainers, gym trainers, said that if there is an emergency, how to use this machine,
Fair enough.
and how to give CPR, and how to save the patient.
Fair. Now, I want to come back to an older point that you made while we were chatting about this. Heart attacks are due to blockages, okay? But we know that blockages build up over time. It's not something that's going to happen overnight, in a week, in a month. So a blockage is building for years probably, but then there is that one thing that tips it over the edge. What is that? Is that exertion? Is that stress? What could trigger that point where a blockage is sitting there, but now suddenly it's become a problem?
So there are few things like uncontrolled hypertension, uncontrolled diabetes, high cholesterol, smoking. They will all build a cholesterol deposition in the coronary arteries, which is known as plaque.
Yes.
So now this plaque is built up in the artery. Now there is some stress, like a mental stress or a physical stress, which will cause rupture of the plaque.
Okay.
So there is a plaque which is built up in the coronary arteries, which will, and some trigger like severe mental stress, severe physical stress will cause rupture of the plaque
in that moment.
in that moment.
Okay.
And that rupture of the plaque will result in formation of a clot in the artery,
I see.
and which will result in sudden blockade of that artery.
Okay. So literally a piece pulls out of the plaque formation and creates a clot, which then creates a blockage.
Absolutely. So that
Okay.
plaque ruptures.
Okay.
And plaque ruptures so that it will aggregate the platelets and form a clot and block the artery.
Understood. Now, again, going back to heart attacks and cardiac arrests, let's look at heart attacks for a minute. Some people collapse instantly. Some people literally say, I think it's coming on. I think I'm having a heart attack. There's such a variance in how long the impact takes to actually reach its culmination. Is that down to severity of the heart attack, or is that something else?
So what happens in heart attack is there is 100% block of the artery.
Okay.
So there is less blood supply to that particular part of the heart. Now few unfortunate patients, there is a creation of an electrical activity which is known as ventricular fibrillation.
Okay.
So if that ventricular fibrillation occurs, then that patient will go into cardiac arrest.
Okay.
And he may not be able to make it to the hospital.
That is the heart stopping completely.
Heart stopping
Yes.
completely.
Yes.
But the others, most of the patients are fortunate. So I would say that symptoms like unusual gas and unusual acidity are never to be ignored.
Okay.
My 99% of the heart attacks come as unusual gas and unusual acidity. Nobody comes as a heart attack. Nobody comes as a chest pain.
Oh, not even chest pain.
Not
That
even chest
little bit on
pain.
the
They
left, the
come with
arm.
this gas and acidity. So any unusual gas or any unusual activity which is sustained, which is prolonged, we need to rule out heart attack.
Okay, so sustained and prolonged is what I'm holding on to, because do I have acidity once in a while? Yes. Do I have gas once in a while? Yes. Usually that is resolved by, the usual ghar ka medication that is available. But prolonged and severity is what I need to focus on.
Yes.
Okay, so and is there a timeline to that? I mean,
No,
over days or in the course of a day?
It is spontaneous. So any unusual feeling, see,
Okay.
usual gas and acidity, you will know that
Yes.
I have been experiencing over a period of time.
Yes.
But anything unusual, which will cause discomfort, which will cause heaviness in your chest, needs to be looked into as heart attack.
So don't wait for the pain to be in your on the
Absolutely.
left side or on the arm. If it's unusual and it's prolonged and it's severe, you need to question why it's happening.
Exactly. And it will occur right here. Most of the time, the uneasiness or heaviness will occur right in front, right in the middle of the chest, which we call it as retrosternal chest pain.
I think the first point over here is awareness.
Absolutely.
You need to know what you're feeling and recognize that it's a little different.
So those who are able to make a note of it and go to the hospital will most of the time make it. So
Yeah.
your question was, some of them make it, some of them don't make it to the hospital. So some of them prolong this gas and acidity, may collapse and may not be able to make it to the hospital.
And that awareness is so important, isn't it? Because uh, we're invariably in our rush to get things done, cover our to-do list, we're ignoring what we're feeling. It's literally job 1, job 2, job 3, job 4. So that awareness, that consciousness, that stopping for 5 seconds and thinking, what am I feeling and is it different, is actually important.
Absolutely, absolutely.
Dr. Chetan, let me come to you with something that people are discussing more and more nowadays. When one thinks of a heart attack, as it were, we think in terms of the blockages, and the blockages that come due to, say, obesity, high stress, high blood pressure, cholesterol. But we've seen more and more healthy people having to deal with this, including, and there's video circulating on social media about somebody literally gripping his chest in a gym. Now, that guy is healthy, he's on a good diet, he's been exercising, yet something like this happens. Now, why is it happening and why is it happening more and more?
So there has to be a strong family history of heart attack. So heart attacks happening in young individuals, there is a very strong family history of heart attack. So his father had a heart attack at a young age, his father had undergone an angioplasty or bypass surgery at a young age. So these are the people who need to be very careful about their lifestyle, about their diet and about their physical activity. They are very prone to having a heart attack without any risk factors. So they need to take drugs called statins as a preventive measure and prevent heart attack.
Now, statins is something one needs to be careful about, right? It used to be the first port of call for medication, but more and more I hear now that cardiologists, heart specialists, they're saying, well, let's see how long we can hold you back on statins, because if you started at a young age, my reference point is for 30s, 40s, the long-term effects of statins tend to be a bit of a problem. So how does a doctor then say, okay, now this is the point where this patient has no choice but to be on statins?
So what we do is we do something known as risks stratification.
Okay.
So if there is a very strong family history of young coronary artery disease, then there is a huge risk in that individual that he will have a coronary artery disease at a younger age. So he is the person who needs to prevent heart attack and needs to be on statin.
Okay.
Not everybody needs to be on statin.
Sure.
But we do something known as risk stratification.
Okay.
And who are the best individuals to benefit from statin. And these are the patients in whom we advocate statins.
Fair enough. Let me now take this from understanding the basics to more the immediacy of the situation. What do you do in the first few seconds, when we've addressed this a little bit? Someone with no medical training, does an AED machine, somebody's trained how to use the defibrillator, but a layperson, no medical training, he's seeing someone having a heart attack, cardiac arrest. What should be done in the first couple of minutes?
So if a person going by, if you are a person who is visualizing that somebody is collapsing, somebody is getting unconscious, and you have no medical knowledge, what we need to do is he can give a thumb on his heart, and then he can try cardiac massage.
Okay.
If he is familiar with.
Okay.
Otherwise, he has to immediately call for help.
Okay.
Help,
Fair
ambulance, take him to the nearest possible hospital if the defibrillator is not around.
Got it.
And if person is suspected to have a heart attack, if he is having chest pain, unbearable chest pain, or unusual gas or acidity, I have said, then if there is a sublingual nitroglycerin available, so he can be given sublingual nitroglycerin as a primary treatment. He can be given Dispirin as a primary treatment, and then rush to the hospital.
This is just something you keep under the tongue?
Under the tongue.
No,
sublingual nitroglycerin is something you keep under your tongue.
Okay, fair enough. There's defibrillators, there's CPR machines, or giving CPR to someone, but I keep hearing about ECMO. What is that?
So ECMO is extracorporeal membrane oxygen. When the conventional CPR fails, it will act as a heart-lung machine.
Okay.
Artificial temporary heart-lung machine, which will do the pumping of the heart and then oxygenate the blood for the time being. So that is known as ECMO, or extracorporeal membrane oxygen, which is used only when the conventional CPR fails.
Now, this will happen at a hospital. This cannot happen.
This cannot happen. This has to happen in the hospital only.
Okay.
and hospital with the ECMO facilities. Not all hospitals have ECMO facilities.
Okay. Okay. So that's important to know
Yes.
when you get there.
Yes.
Okay. Now, this getting to the hospital, is the timeline correct within 60 minutes? People, like somebody's had a heart attack, the chances of survival, if you get him to a hospital, get him or her to a hospital within 60 minutes, is much better than over 60 minutes, or has that timeline
No,
changed?
it's absolutely, you are right. Sooner the better.
Okay.
So we call it door to balloon time. So when we undertake a patient for an angioplasty, heart attack patient, when is he taken for an angioplasty, we call something as door to balloon time.
Okay.
So from the door of the patient to the balloon inflation in the cath lab. So
Got it.
if it's like less than 1 hour, then we can preserve the entire heart function of that particular patient.
I see.
He will not have any heart dysfunction.
Got it.
So
Okay.
longer the time, more are the chances that there'll be LV dysfunction, there'll be left ventricular dysfunction, there'll be cardiac dysfunction if the time is more. The lesser the time, better are the chances of preserving the cardiac function.
I'm just imagining this situation. This 60 minutes will also include the patient's processing time of, is this unusual? Should I be going to a hospital?
No, that will include door to balloon time.
Okay.
So when the patient decides
Okay.
that there is a problem and I get out of the house,
Ah.
so that is known as door to balloon time. So
Okay.
if it's less than 1 hour, it's always very good for the patient.
Got it. Now, what is this thing about ice baths? It helps in recovery, it helps in prevention, or it helps in the matter not getting worse. What is the ice bath story over here?
So ice bath has been very popular, but it's extremely risky. It's extremely dangerous
Okay.
for the patients with stroke and heart attack. What it does is sudden drop in temperature will cause severe vasoconstriction of our arteries, including the arteries of the brain, which will cause sudden increase in the blood pressure and worsen the situation of stroke and heart attack both.
That can't be good. You're constricting veins, you're increasing blood pressure.
Absolutely.
So, what is it meant to do that people
I am not too sure, but
Okay.
it should not be given.
Okay, so fair. Ice baths is off the table.
Yeah.
In spite of what
no,
one.
No. Big no to ice bath.
Okay, whatever you read on social media and all.
Forget
and
it.
That's the difference between talking to an experienced professional and basically seeing a video saying, "Hey, this works." So I'm glad we're having these conversations, and I'm glad we're busting all these myths. Let me now address the future of cardiac care. From what was happening in the 80s and the 90s to even now, literally in the course of your career, you have seen so many advancements. But let me put it to you this way. There are patients that undergo angioplasties, and then eventually they also have to end up doing a surgery. So an angioplasty is not a be-all and end-all, as it were. What can we do to stop an angioplasty a few years later turning into a bypass?
Sure. So now, if somebody has a heart attack, he is taken on angiography table. He has undergone an angiography. Now, there are multiple blocks in his arteries.
Sure.
So, there are blocks in his right coronary artery, there are blocks in his left anterior descending artery, there are blocks in circumflex artery, but he has got an inferior wall MI. So, right coronary artery is responsible for causing this heart attack.
Okay.
So, at that time, we do something known as culprit vessel angioplasty. So, right coronary artery is responsible for a present heart attack.
Okay.
We open up the right coronary artery and preserve the function of the heart which is being supplied by that artery.
Okay.
Okay, so that
Okay.
is known as culprit vessel angioplasty to prevent heart attack, to save the heart function in that particular patient.
Okay.
Now, if he has got multiple other blocks with lots of calcium in left anterior descending artery and left circumflex artery, probably it will not be a fair idea to do angioplasty in those vessels as well.
Okay.
So what we do is we send that particular patient for a bypass surgery if
Okay.
the arteries are not suitable for angioplasty. So that is in heart attack patients.
Okay.
Now, if some patient has already undergone an angioplasty and he does not take care of himself, so he smokes, he takes junk food, he does not do good healthy diet, no physical activity, he forgets taking his medications, then definitely the stents will also get blocked.
You're saying that with some level of stress, as it were, because you have seen this happen often enough, I'm assuming. Okay.
So, to see a stent blocking is a very painful thing.
Yes. Yes,
So
I
I
can
have put in
imagine.
a stent, I have put in a 3, 4 stents, and those stents are getting blocked in a year's time because of negligence of the patient.
A year. We're not even talking 5 years or a decade.
It can happen in a year's time also
Oh, good Lord.
because of the negligence of the patient not taking medications and the stents getting blocked
Okay.
is something very common. So we harp upon on discharge. I harp upon that you need to do regular physical activity, you need to stop smoking, you need to take your antiplatelet agents. So we give aspirin
Okay.
and we give prasugrel, ticagrelor or clopidogrel as second antiplatelet agent.
These are not blood thinners.
These are blood thinners.
Oh, okay.
And
Okay.
they need to be continued for at least years time
Okay.
in all these patients. Now, if patient fails to do all this, he will develop blocks again and he may have to undergo bypass surgery.
Okay. So the lack of taking care will lead you from one to the other.
Absolutely,
Okay.
absolutely.
Now, tell me about gene therapy, sir. They talk about gene therapy being almost a solution to surgeries. Now, surgeries still happen. They happen by the hundreds every day. But are you seeing medical advancements that are leading us to the point where we might not need as many surgeries as happen now?
So gene therapy is a very promising therapy.
Okay.
So what it does is it will try to improve the cardiac function and addressing the molecular mechanisms which are contributing to the heart dysfunction. So it is a very promising therapy in heart failure patients.
Okay.
So initial trials showed us very promising results.
Okay.
But the larger trials did not show us very promising results.
Okay.
So I would say it's still in investigation. It's
Okay.
still at the trial phase, and we need to wait for the results of larger clinical trials.
Okay. So it's not mainstream by any
Absolutely.
stretch, but it's something to keep your eye on.
Absolutely.
Okay. Let me also come to diabetes medications. There's this whole Ozempic story, but we'll leave that aside for a minute. But there's people who say that SGLT2 inhibitors, am I saying that correctly?
Yes.
It's a diabetes drug, but it seems it reduces the risk of heart attacks, or it can be prescribed to heart patients, as it were. What is happening there?
So SGLT2 inhibitors are drugs which are one of the 4 pillars of heart failure treatment.
Okay.
So what are the 4 pillars of heart failure treatment? So the beta blockers like bisoprolol and metoprolol.
Okay.
Then there are renin-angiotensin system blockers or RAS blockers, which is like ARNI or sacubitril/valsartan combination. Then there is something known as mineralocorticoid receptor antagonist like spironolactone or eplerenone and SGLT2 inhibitor.
Now, sir, if you ask me to repeat your last two sentences, I will not be able to. Can you break it down for me? What do these 4 pillars or the medications for these 4 pillars do?
Beta blockers.
Okay.
Beta blockers are anti-adrenergic drugs.
Okay.
So there is an adrenaline surge in
Yes.
heart failure patients.
Okay.
So that will control the adrenaline surge in heart failure patients.
Got it.
Renin-angiotensin system blockers will do a lot of vasoconstriction in the heart failure patients. So
Okay.
that will do vasodilatation and positive effect on the kidney.
I see. Okay.
Mineralocorticoid receptor antagonist will work at a kidney level and work at an hormone level, block the mineralocorticoid receptors and give a positive response in heart failure.
Got
And
it.
SGLT2 inhibitors. So SGLT2 inhibitors are wonder drugs. They are empagliflozin and dapagliflozin, and they have been working at a kidney level. At the level of the kidney, they will drive the glucose out in the urine. At the same time, they've got a lot of positive effect as far as heart is concerned.
Okay.
So there have been a lot of studies, and now they've concluded in different guidelines that SGLT2 inhibitors can be given to the spectrum of heart failure. So heart failure we divide in 3 categories. Heart failure with reduced ejection fraction, meaning if the pumping function is less than 40%. Heart failure with mid-range or mildly reduced ejection fraction. That
Okay.
means pumping function is between 40 to 50%.
Okay.
And there is new entity which is known as heart failure with preserved ejection fraction.
That can happen. I thought this ejection fraction was literally an indicator to will you have a heart problem or not.
No, so now there is something new entity known as heart failure with preserved ejection fraction. So even if your heart pumping is more than 50%, you can still have heart failure.
How does that work? I mean, I thought that was not supposed to happen.
So that happens, if the heart is not able to relax properly, even if the pumping is fine,
Okay.
the heart is not able to relax properly, then it can go into heart failure.
Got it. Okay.
So SGLT2 inhibitors like empagliflozin and dapagliflozin In all the guidelines, they mention that they are first-line therapy
Okay.
in all these three spectrum of heart failure patients.
I get it. So, when you say relax, the first word coming to my mind is stress, though you might not have meant it like that. But uh, look, the line that you shouldn't take stress, you should relax is so easy to say. But it's not going to happen. We live in metro cities, we lead busy lives, we have families, work, responsibilities. Stress is almost a byproduct of this. So to say don't stress is very difficult. But say we go back to that awareness, that consciousness part of it, where we want to get into we want to consciously look at stress alleviation as a measure. What does one do? Is there a daily exercise one can do? Is there something that I should be taking care of or looking at on a regular basis to consciously reduce stress levels?
So I would recommend three things.
Okay.
First is regular physical activity. What regular physical activity does is it will cause endorphin release.
Okay.
So endorphin release is, they are the hormones from the brain which will give a positive response and which will decrease the stress hormones and improve cardiac function. Secondly, we need to do mindfulness and meditation.
Fair.
So
Okay.
mindfulness and meditation will again decrease adrenaline levels, decrease cortisol level, and have positive effect as far as the stress is concerned. And third most important thing we many times forget to do is to have a good sleep. Sleep of 7 hours is must in our busy Mumbai life.
Okay, I want to break this up because when you say physical exercise, what is the timeline? 30 minutes, 45 minutes, 60 minutes, more?
So I would say 5 hours a week.
Okay, 45
5
minutes.
hours a week.
Okay.
So if you do an hour of activity, 5 days a week, if you do 45 minutes of activity, you can do 6 days a week.
Yes, yeah.
So I think that's a very reasonable activity. Now we
Okay.
divide this physical activity into low intensity workout, moderate intensity workout, and high intensity workout.
Sure.
So if you do low intensity workout, you do 1 hour of activity for all 7 days. If you do moderate to severe intensity workout, then 1 hour 5 days a week or 45 minutes 6 days a week.
Okay,
But you need to give 1 day rest to your body.
I understand. Okay, so Sunday is a
Yeah,
good day.
Sunday
and then,
or any day.
And then
So
run with
Sunday
it.
I do my long run, so I give Saturday a skip.
Fair enough. Okay. And sleep, I get the 7 hours, 8 hours that one should do, minimum 7. But there is something to be said for also doing it at the same time. Is it not? You can't sleep at 10 one day, 12 the other day. Isn't there a correlation?
Yeah, so there is a clock, the natural body clock.
The
which
circadian
is,
rhythm as
yeah,
well, yes.
circadian rhythm, the hormone release. So the hormone release, the melatonin is being released after 7 p.m. in our bodies.
Okay.
So by 10 p.m. the hormone melatonin will reach its peak.
Got it.
So if you start sleeping at 10 o'clock, it's most physiological.
Got it.
So
Okay.
10 to 5, the melatonin levels are the highest.
Okay.
So 10 to 5 probably is the best time in our ancient time also.
Yeah. Post sunset.
Early to sleep and early to rise.
Absolutely. Absolutely. And the problem with so many of us is that we'll sleep at midnight, but the day will still start at 6 in the morning. And then therefore you have not gotten your quota of sleep. Is there something to be said for I will make it up on the weekend? Does that actually work, or is it just something I'm saying to keep myself happy?
No, you have to do it every single day. You cannot make it up on the weekend.
Okay, fair. Now, I want to go back to a point that you made, just this whole lesser known risks element, high intensity workouts. It's meant to be great for the body, but sometimes that can be a problem in itself. How do I know whether I'm a fit candidate for high intensity workouts, or it's actually more of a risk factor than it is a good thing?
So high intensity workout may be not good for the patient with pre-existing heart disease,
Fair.
like hypertrophic cardiomyopathy, dilated cardiomyopathy, or pre-existing coronary artery disease. So many times you find that there is an athlete on a football ground suddenly getting unconscious and suddenly dying. So probably he has a entity known as hypertrophic cardiomyopathy, which has gone undiagnosed, which
Okay.
has not been diagnosed. So
What is this, sir?
hypertrophic cardiomyopathy is the heart muscle. So there is a interventricular septum which is very thick. So
This is a heart wall we're talking
heart
about.
wall. So
Okay.
there is a septum which separates the right ventricle and the left ventricle.
Okay.
So that septum separating the right and the left ventricle is very thick in these particular patients.
Okay.
So it is hypertrophied.
So this just happens, or is
It's
it
by
a
birth. It's by birth.
Okay.
And it goes in family. So you need to have family surveillance also.
But then how do I know whether this
So exactly.
exists in me or not?
So what we need to do is I recommend all my patients getting into marathon training, getting into high intensity training, getting into trekking to undergo a 2D echocardiogram. So
Okay.
it's a very simple test. It's like sonography of your heart, and you will see this entity very well on 2D echocardiography.
But there's so say somebody has this. So now one knows that that person should not be doing marathons or Everest base camp and things like that. But there's no solution.
No, there are solutions. So if the septum is not very thick and the obstruction is not huge, then you can do routine physical activity to some extent.
Okay.
I would not prevent that particular patient's doing nothing.
Got it.
But if the septum is very thick and there is a lot of obstruction to the left ventricular outflow tract, then he should not be doing anything.
Okay. Got it. But this is the prevention better than cure kind of thing.
Absolutely.
You need to know either whether you're feeling anything or not feeling anything. You go do an annual test, and as you get older, it becomes more important that you do that just so that you know what's happening in your body.
So 2D echo is a must once in 4-5 years.
Okay.
And I would recommend a stress test every year.
Okay.
In every patient who is undertaking this marathon training or physical activity after 40.
Got it. Okay. So again, preventive and just so that you know what's happening in your body. Another technique that is used to do exactly this are fitness trackers and smartwatches. And I've read articles where they've said things like it could even give you an early warning sign for a heart problem. Have you known that to be true? Have you seen patients come to you with saying, my fitness tracker is telling me to come to you?
So I am with the smartwatch
Oh, you are yourself.
all the time.
Okay.
What it does, it gives you an information about your heart rate.
Sure.
Nothing else.
Okay.
So the increase in your heart rate with your physical activity and daily increase and decrease in your heart rate will be shown by the smartwatch.
Okay.
Otherwise, it does not tell us anything about prevention of heart attack, about the risk of heart attack. It will many times confuse us by
Too much data.
Abnormally increase in the heart rate. You will get confused. So I would say just have a look at your heart rate. How much does it increase with your physical activity, and that is it. Don't rely too much on your smartwatch or on your devices.
At what point of an elevated heart rate should I say to myself, I'm not feeling anything, but this is an odd number, I should go see a doctor?
While exercising or while at rest? So while exercising...
Let's do both.
Yeah. So while exercising, there is something known as maximal heart rate.
Okay.
So your maximal heart rate is 220 minus your age.
Okay.
So if I'm 60, my maximal heart rate should be 220 minus 60. That is 160.
Yes.
So if my heart rate repeatedly goes above 160, then I need to be careful.
This is while I'm exercising.
While I'm exercising.
Okay. Okay.
So I should keep it at 80% of my maximum heart rate.
Got it.
So I should not go to my maximal heart rate all the time. 80% of my maximal heart rate. So I need to plan my physical activity so that I'm at 80% of my maximal heart rate.
Okay.
Now, in a normal individual, at rest, if the heart rate is consistently more than 100, then that person needs to consult a doctor, consult a cardiologist, and get it fixed.
Irrespective of whether they're feeling anything or not.
Anything. So,
Okay.
a heart rate more than 100 is a risk. So,
Okay.
even for life insurance policy, if you go to take a life insurance policy and if your heart rate is more than 100, they will levy you extra premium.
Fair enough. I've known that to happen.
Yeah.
I've known that to happen. So the smartwatch comes in handy for just about that.
Heart
You
rate.
can test your heart rate, and
Absolutely.
if there is an elevation, then we have to worry about it.
Absolutely.
Okay. I want to come to something else, blood thinners. And I realize that for some people, for a lot of people, it is the first line of treatment like we were discussing. But in some cases, because of other medical conditions, blood thinners can't be taken. What are the alternate therapies to that?
So, if you have undergone an angioplasty, blood thinners are a must for 1 year.
Got it.
Whatever the condition may be.
Okay.
So, if the patient has an excessive bleeding tendencies, then what we do is we give dual antiplatelet therapy, dual blood thinner for 1 month,
Okay.
and then put him on a single blood thinner for at least a year.
Okay.
And then we can review. So
Okay.
that single blood thinner, be it ticagrelor or prasugrel, and the dual antiplatelet therapy is aspirin plus ticagrelor or prasugrel for at least a year.
And intense monitoring, I would assume.
Intense monitoring.
Okay.
Now, if the person has got only heart attack or undergone a bypass surgery, then he may not need dual antiplatelet therapy.
Okay.
So we can just put him on a single antiplatelet therapy, a single blood thinner,
Okay.
with the lesser risk of bleeding.
Got it. Okay. So, but that is a case-to-case basis, and that is for the
Absolutely.
doctor to decide
Yeah,
and
it is
recommend.
totally at the discretion of your cardiologist.
Fair enough. There's another element, since we're on the subject of things that aren't really on the radar, but they're getting there. Gut health and the microbiome, as it were. There is now more and more research saying that gut health and heart health are quite connected.
Absolutely. So, there is an ancient Indian saying that if you are good at your tummy, if you are good at your gut, then everything will be fine. Your body will be absolutely fine.
Fair enough.
So, gut health and heart health are very, very close to each other. And there are probiotics, there are prebiotics. So, I would insist natural probiotic. So, natural probiotic is our dahi.
Yeah.
Our yogurt is natural probiotic. I think everybody should consume that.
Okay.
Our natural prebiotics. So, what are natural prebiotics? So, garlic and onion.
I've never clearly understood the difference between the two. I'm very familiar with the phrases, but I don't know what that means.
So, pro is will increase the microbial flora.
Okay.
And pre is stimulate the microbial flora.
I see. Okay. Okay. So one consumes this by regular, you mean literally daily basis?
Yes.
So prebiotics are garlic and what else?
Onion. Natural prebiotics are onion
Okay.
and garlic. And probiotic is yogurt, dahi.
Now, this is not meant to be eaten raw. Even if it's in the cooking, that's fine.
Yeah, absolutely.
Okay. And on a
And
daily
a
basis.
good diet,
Okay.
which is full of fiber, which is full of fruits, which is full of legumes, which is full of nuts.
Got
So
it.
nut, I would recommend that walnut and almond are probably very good for heart, and pistachio and cashews are not so good for heart.
Oh, is that right?
Yes.
Pistachio and, well, cashews, yes. But pistachio, I did not know.
Yeah.
Okay. Also that.
So almond and walnuts are probably best for heart.
Okay. And this is...
They will increase your HDL level. HDL is a good cholesterol level.
Yes, absolutely. So, and I want to make this correction because I don't know how many times I've had this conversation that when you say these are good for your heart, you don't mean the smoked, masala, roasted version. You mean literally plain.
Absolutely. Plain.
Everybody, let's take note of that. Okay.
Absolutely.
Many
absolutely.
arguments have happened
So
on this
we have
one.
lots of almonds which are smoked, almonds which are cooked,
Yes.
almonds which are with masalas. So no, I would recommend plain almonds, plain walnuts,
Okay.
which are good for your health.
Absolutely. Sir, I want to, we've covered so much, but in closing, I just want to go over this. If there was one element that you could tell a layperson, not someone who's under treatment right now, because those are different parameters, that they should do consistently, just from a preventive point of view, from a health point of view for their heart, what would it be?
So, I tell all my patients, if you come across my patient, they will definitely know this. I tell all my patients at the end of my talk that try to avoid deep fried food, try to avoid butter cheese, try to avoid sweets,
Okay.
take small frequent meals, do regular physical activity. So charity begins at home. I tell them that I do 1.5 hours of workout every single day
Wow.
at the age of 60.
And with your schedule.
With my schedule.
Yeah.
And I would recommend that they will do at least 45 minutes of physical activity. So I harp upon.
Okay.
Because they will ask me, doctor, do you do it? And I have to tell them, yes, I do it. So I do it and I recommend it to you.
Fair enough.
So regular physical activity, yoga, meditation is very important.
Okay.
So few minutes of meditation, 10, 15 minutes of meditation will
Just
really help you.
Focused breathing?
Yes,
conscious
focus breathing.
Okay.
Or have some medication, YouTube medication video.
Oh, there's so many of those.
So
Yes,
many
the
of those.
yoga meditation videos on YouTube. Yes.
And prayers. Prayers, according to me, are very important. I do each and every angiography. Prasad will know, my friends will know, that I chant Gayatri Mantra Om Bhurbhuva Swa and start my angiography.
Fabulous.
For last 30 years, I've been doing that. Each and every angiography has been started with a prayer.
Absolutely right. Because At some point, there is a universal power, there is a higher power
Absolutely.
that you're meant to go to for help when you need it, even if you don't, just to be connected. Absolutely. But,
Absolutely.
sir, on that note, we'll call it a wrap. But thank you so much, Dr. Chetan, for your words of advice and for the learnings that we have gotten in this. We read about it all the time, but to have it said by a professional is a huge help and very impactful. Thank you so much for this.
Thank you.
Sometimes the signs are quiet, but listening to your heart, really listening, can change everything. A heartfelt thanks to Dr. Chetan Shah for guiding us through the facts, the myths, and what truly matters when it comes to heart health. If this conversation gave you a new perspective, pass it on. Someone else might need this just as much. Until next time, stay curious, stay aware, and keep your heart in the loop. In the heart of Mumbai stands a name trusted by thousands. Over 1 lakh heart procedures, 200 plus years of combined experience. From diagnosis to recovery, your heart gets complete care under one roof. Because when it comes to your heart, experience isn't optional, it's everything. Zynova Shalby Hospitals. Experience you can trust, care that you deserve.